My name is Dr. Will Posten, and I'm a Mohs surgeon at Advanced Dermasurgery Associates, part of Platinum Dermatology here in Dallas, Texas. I've been practicing here for 22 years and mostly focusing on skin cancer, and we also do surgical dermatology as well, which includes the treatment of keloids. Yeah, so it's considered to be a very safe treatment. There are guidelines in every state for how radiotherapy gets delivered, and I think if you follow the licensure and guidelines, it should be considered to be a very safe treatment. Contraindications can include if you've had previous radiotherapy to a site. There's a lifetime max of radiation that can be delivered to a site. Typically, it's considered to be 50 grays or 5,000 centigrays is usually the maximum area, and usually, the maximum amount of radiation you can deliver in a lifetime to a site. And so usually when we're doing keloids, we're usually delivering around 1,800 centigrays, which is, theoretically you can retreat it once or maybe twice, but if someone's had it before, it definitely gives us pause, and it is something to think about if you have to do it twice in the same area. So this has definitely been an issue historically. Historically, insurance companies have typically not reimbursed for the treatment of keloids, as they consider keloids to be a benign condition. That being said, more recently, insurance companies have been reimbursing this more and more. In our clinical experience, we find that about half the time, insurances will reimburse for the surgery plus the radiation. And the other half of the time, patients really like this and will self-pay to get the treatment done. Having practiced for more than 20 years, this is probably the most exciting time of all to be practicing dermatology, because there's always new advancements, new treatments, and particularly this one is one that I'm super excited about because it was just not available, when I was in training. And so I would encourage any dermatologist to go and find out if it's something that they can offer in their clinic, or find out the people who are offering it in their area and see if they can coordinate with them to get this, oftentimes disfiguring and life altering condition. When people have keloids, it heavily affects their personal, social, and work lives. And now that we have what I think is a way more successful treatment than what was available in the past, I think it would be great if more and more patients had the ability to get this done.